5 popular drugs that cause liver damage. Did you know that excessive use of medications in everyday life, such as those for headaches, can cause serious damage to your liver and potentially lead to death? I'm sure you've taken some of these medications, and you might even have some in your home right now, isn't it? Today, you're going to learn about the signs of liver damage that you need to watch out for, how to prevent such damage from occurring, and how to find out if the medications you have at home are harmful to the liver. Did you know that the liver is the largest solid organ in our body, vital for our survival and well-being? It diligently works to detoxify the blood, assist in digestion, and restore energy levels functions we cannot live without. This crucial organ also plays a significant role in the metabolism of medications. Unfortunately, certain drugs can directly harm it, resulting in what is known as drug-induced liver injury. So, what makes the liver particularly susceptible to damage from medications? As you eat, drink, and take medications or supplements, your liver is the unsung hero tirelessly filtering these substances, storing nutrients, and eliminating waste. This constant processing significantly heightens the risk of encountering harmful agents, with numerous studies indicating that a variety of medications, including herbal medicines and dietary supplements, can increase the likelihood of liver damage. In today's video, we'll discuss the 5 most popular medications that can harm your liver, what symptoms to look out for, and what you can do to prevent and safeguard your liver against these potential harms. 1. Tylenol. This widely used over-the-counter pain reliever and fever reducer contains acetaminophen, which is generally safe for the liver when used sporadically and within recommended doses. However, liver damage can occur with large doses or chronic use. Even a single excessive dose of Tylenol can result in liver damage, a condition known as Tylenol overdose. This constitutes a medical emergency necessitating immediate action. If you suspect an overdose, it's critical to call a poison control center or go to the nearest emergency room without delay. Frequent use of Tylenol or taking it over an extended period can lead to liver damage. This risk is heightened in individuals with chronic illnesses, alcohol use disorders, or pre-existing liver conditions. You can reduce the risk of Tylenol-related liver issues in the following ways. Never exceed the maximum recommended daily dosage, which is 4,000 milligrams. Avoid drinking alcohol while taking Tylenol. Always check whether acetaminophen is an ingredient in other medications you are taking, including both over-the-counter and prescription pain relievers, to avoid unintentional multiple dosages. Be aware that many common cold and flu remedies also contain Tylenol, acetaminophen. Acetaminophen is known to potentially harm the liver by producing a toxic byproduct during its metabolism. This metabolite can build up over time, leading to structural changes in the liver and impairing its normal function. Drug-induced hepatitis is a condition where the liver becomes inflamed due to the effects of certain medications, often as a result of excessive or inappropriate use. Medications that are known to be harsh on the liver, such as acetaminophen or nimesulide, can significantly increase the risk of developing acute or even fulminant hepatitis. Aside from acetaminophen, other pain relievers like Advil, ibuprofen, Voltaren, diclofenac, and Solindac are also known to be associated with liver injury. Many of the medications you take are effective only until they pass through the liver, because there, many drugs are inactivated and then eliminated from the body through feces or urine. Thus, the liver prevents the medication, which has already served its purpose, from accumulating in the body, potentially causing harm. Anyway, this protective mechanism can paradoxically endanger the liver. In the process of neutralizing medications, the liver can inadvertently produce a toxic compound. It's somewhat ironic that medications we rely on daily can pose such risks, isn't it? 2. Diclofenac. Diclofenac, sold under brand names like Cataflam, is an anti-inflammatory medication frequently used to alleviate pain from various injuries and conditions, including arthritis. The concern primarily relates to oral ingestion rather than topical application. The topical applications such as gels, creams, and patches carry a lower risk of liver injury since the body absorbs significantly less of the drug compared to oral forms. Chronic daily use, particularly in individuals susceptible to liver issues, may heighten the risk of severe liver injury over time. Non-steroidal anti-inflammatory drugs, NSAIDs, are commonly taken for pain, inflammation, and fever. Some are available over the counter, but others, such as oral diclofenac, Cataflam, are available only by prescription. Diclofenac stands out among NSAIDs for its potential to cause liver injuries. Often, such damage may be enough to cause abnormalities in liver function tests, LFTs, without producing noticeable symptoms. LFTs assess the levels of liver enzymes, which are proteins, and elevated levels can signal liver injury. These tests are conducted through blood samples taken by healthcare professionals. Although serious liver damage from diclofenac is uncommon, the risk increases in women with higher dosages and with extended use, typically beyond 4 weeks. 3. Amoxicillin clavulanate. Amoxicillin clavulanate, commonly known as clavulin, is an antibiotic combination that many have used to combat bacterial infections, such as pneumonia, urinary tract infections, and sinusitis. Have you taken this medication before? If so, let us know in the comments. Surprisingly, following paracetamol, amoxicillin clavulanate is one of the leading medications associated with liver damage. The combination includes an antibiotic and a substance that inhibits bacterial resistance to the antibiotic. It's thought to cause liver damage through an allergic reaction within the body, though the precise mechanism remains unclear. Other drugs frequently linked to liver injury include antibiotics like isoniazid, trimethoprim, sulfamethoxazole, erythromycin, nitrofurantoin, minocycline, and the antifungal medication ketoconazole. 4. Statins. Statins, including well-known varieties such as simvastatin, atorvastatin, Lipitor, and rosuvastatin, are among the most widely prescribed medications worldwide due to their effectiveness in managing high cholesterol. They do, however, carry a risk of liver injury. Those meds are thought to cause liver damage by producing a toxic metabolite or provoking an allergic reaction, although the exact mechanism is unknown. Zocor, simvastatin, another statin, has also been associated with liver injury. Liver damage from these medications is usually mild and typically reversible after a patient stops taking the drug, with guidance from their healthcare provider, of course. In such cases, you can usually continue using the medication. However, if there's a severe increase, switching to a different statin might be necessary. Liver issues with statins are uncommon, but as a precaution, your healthcare team might conduct a liver enzyme test before you start the medication or soon after. Further testing is typically not required unless you experience liver-related symptoms, including unusual fatigue, weakness, loss of appetite, upper stomach pain, dark urine, or yellowing of your skin or eyes. It's important to contact your healthcare professional immediately. 5. Amiodarone. This is a medication prescribed for managing irregular heartbeats. It's noted that elevated liver function tests, LFTs, may occur in up to half of the individuals on long-term amiodarone therapy, although this elevation typically does not lead to severe health issues. However, there is a small percentage, about 1% of users, who may experience more significant liver damage. Due to this potential risk, the FDA has placed a boxed warning, which is their highest alert level, on the drug to inform both patients and healthcare providers of the serious risk it poses to liver health. It's important for those taking amiodarone to have regular monitoring of their liver function and to consult with their healthcare provider for any concerns or symptoms that may arise. Liver injury related to amiodarone is more common in people who take the medication at higher doses and for long periods of time. Thankfully, this risk can be monitored. You'll likely have regular LFTs while taking amiodarone to make sure your treatment doesn't need to be adjusted. Can supplements cause liver damage? Yes, supplements can potentially cause liver damage. In fact, studies indicate that supplements are responsible for up to 20% of liver injury cases in the United States. Dietary supplements that have been linked to liver damage include bodybuilding supplements that contain anabolic steroids, weight loss supplements with green tea extract, certain vitamins such as niacin, particularly when taken in high doses up to 3,000 milligrams per day over several months, herbal products like ginseng and black cohosh, and other multi-ingredient nutritional products. It is important to approach the use of dietary supplements with caution and to consult healthcare professionals before starting any new regimen, especially those that might involve high doses or long-term use. Early signs of liver damage from medication. The liver, resilient to many forms of injury, can rapidly deteriorate and fail within days. Symptoms often start with nausea and vomiting, progressing to severe abdominal pain, and in extreme cases may result in a coma. Monitoring bodily symptoms is crucial to detect potential liver damage from medications. Early signs may include stomach pain, fever, diarrhea, dark urine, jaundice, which is the yellowing of the skin and eyes due to high bilirubin levels in the blood, nausea and vomiting, extreme fatigue or sleepiness, rash and pale or white-colored stools. If you experience any of the symptoms mentioned, it's critical to seek medical attention immediately. Bringing the medication boxes you've used in the past weeks can be very helpful to the healthcare professionals as it aids in guiding appropriate treatment. Liver damage is a serious condition that can escalate to life-threatening levels without timely intervention. Without prompt treatment, options may become drastically limited, often leading to the necessity of a liver transplant or, in the most severe cases, resulting in death. The liver's drug inactivation process is generally consistent across the population. Nevertheless, variations can occur. This explains why some individuals exhibit sensitivities or intolerances to certain medications. Their livers process drugs differently, leading to adverse reactions. Have you ever encountered someone who is sensitive to specific drugs? Their unique physiological response to medication metabolism is the underlying reason. Individuals can exhibit differences in how rapidly or slowly they inactivate drugs, and their livers may carry out various modifications. In some cases, this process can generate toxic molecules. Such variability significantly impacts the risk of drug-induced liver injury, underscoring the importance of close monitoring of liver function during treatment with certain medications. Moreover, some medications can prompt a severe immune reaction, leading to liver damage. Vigilance in observing any signs of liver injury is crucial, particularly when taking medications with a known potential to affect liver health. This discussion has highlighted 5 particular medications known to cause liver damage, but it's important to be aware that there are other drugs which might carry similar risks. So, to determine if the medications you are taking carry this risk, you should look for the section on adverse effects in the drug's leaflet. Do not panic if you see that there is a risk of hepatitis or other liver diseases listed. Always have an open dialogue with your healthcare provider about any medication-related concerns you have. Drug-induced liver injury, while serious, is relatively rare in the general population. If you found this video helpful, give it a thumbs up and consider sharing this information with your loved ones. If you want to stay informed about health and well-being, subscribe to our channel and hit the notification bell to stay updated with our latest content. For more insights on health and lifestyle, you might also find additional interesting videos popping up on your screen right now. Feel free to click on any of them, or even better, watch both to further your journey in health knowledge with us. Take care, see you in the next video, bye.